sexual attraction? The ventromedial prefrontal cortex is a part of the brain and is responsible for processing fear and risk as well as the inhibition of emotional responses. It is located in the frontal lobe at the bottom of the cerebral hemispheres in the prefrontal cortex. The limbic system is a big part of the brain that supports a variety of functions including emotion, behavior, motivation, long-term memory, and olfaction. These and areas of the brain involving senses are what promote the recognition and grading of sex appeal. During sex, the brain acts as a pleasure center, determining what feels good and what doesn't by communicating with the nerves in the genital area. There are about 8,000 nerve endings in the clitoris and 4,000 nerve endings in the tip of the penis. There are 4 types of nerves that are stimulated during an orgasm. They are hypogastric nerves, the pelvic nerves, the pudendal nerves, and the vagus nerves. These nerves transmit signals to and from different parts of the reproductive system. The hypogastric nerve sends signals to and from the uterus and cervix in women and the prostate for men. The pelvic nerves send signals to and from the cervix and vagina in women and the rectum in both sexes. Pudendal nerves send signals through the clitoris in women and the penis and scrotum in men. The vagus nerves transmit signals from uterus, clitoris, and cervix in women. The areas of the brain impacted by sexual arousal include the amygdala, nucleus accumbens, ventral tegmental area, cerebellum, and the pituitary gland. Sexual arousal experienced by the body floods the brain with neurochemicals, which are essentially chemical messengers that forge emotion, feelings, and even love. The level of pleasure is based on the release of these chemicals.
Welcome to Channel 69 News. I'm your host, Tanner Reagan.
And I'm your co-host, Lizzie Young, with breaking news. It's been brought to our attention that teens all over the world have been misinformed by improper sexual education videos. We're going to investigate this topic and see what we can do. What have you got, Tanner?
This just in. One of the main topics teens should know is how a penis and a vagina function.
An article from School Work Helpers of Everyday Health explains the penis is an organ that's highly sensitive to sexual pleasure. When an erection occurs, blood rushes down to a storage unit in the penis where blood is held. The driving fuel for male ejaculations is testosterone. In the man's testes, testosterone and sperm are produced. The sperm is mixed with a whitish protein-rich fluid called semen. Semen helps the sperm survive for a limited amount of time after ejaculation. The steps to reach a male orgasm are pretty simple. First, the male must be aroused and have an erection. The muscles tighten up and prepare the body for orgasm. When the point of orgasm is reached, there are 2 parts. Ejaculation and inevitability. At this point, semen travels to the urethra and cannot return. Next is the orgasm itself. After ejaculation, the penis immediately loses its erection and will not be able to sustain another erection until at least 30 minutes after the orgasm occurs.
Now, let's talk about the vagina. All right, so the vagina is a tube-shaped organ where the penis is inserted during sex. The length of the vagina may reach from 3 to 7 inches.
When aroused.
The vulva is a vaginal opening to the uterus. The uterus, also known as womb,
The womb.
nurtures the fetus before giving birth. The clitoris is an erectile tissue that is a high-pleasure center. The steps to reach a female orgasm is a little bit more complex. The orgasm can be achieved through clitoral or vaginal stimulation. But the first step is excitement. Blood fills up the clitoris and vagina, creating a full-body sexual blush. Then, as sexual intercourse occurs, the outer third of the vagina fills up with blood. This sexual stimuli drains all other sensations of the body. Your heart rate, blood pressure, and respiration continue to increase. When the female orgasms, the muscles in the vagina and uterus tighten up. Other muscles throughout the body may contract along with the orgasm. The body then relaxes with the blood flowing away from the sexual organs. Your heart rate, blood pressure, and respiration return back to normal.
Now that we know a little bit about how the penis and vagina function, let's go to Jasper with masturbation. Jasper?
Thank you, Lizzie. So, the topic masturbation has been trending everywhere lately, but the question is, Why is masturbation pleasurable? Surprisingly, there's no easy answer to this. For guys, friction against the penis creates a stimuli that makes the penis erect, and with enough stimulation, the male will orgasm. For females, it's a bit more difficult to achieve orgasm through masturbation, simply because some don't know how to masturbate properly or are just incapable of achieving an orgasm. The location and sensation that's strongest, however, is discovered through self-discovery and experience. Knowing your own body, part of the act of the masturbation experience, and knowing yourself is key to how fast or how quickly you can orgasm. However, 20% of women, 1 in 5, are never able to reach an orgasm through sexual activity. Why is masturbation pleasurable, though? There are multiple reasons for that, one of which is the neurological response to pleasure from the brain due to the want of excitement. Now that the question has been answered, let's go to Dr. Mechanic for the Q&A.
Channel 69 News has been brought to you by
Dick's Hardwood Flooring, where all the wood is hard.
So I'm Brad McCamick. I'm a pediatrician. I work at Vista Community Clinic, and I've worked there for 2 years. And I see kids from 0 to 18, and I often will meet with teens, talk about issues related to sex and reproduction. So, penis size. There are medical conditions related to penis size. Abnormally small is if hormonally, if that patient is having problems with development, which might indicate a larger problem in terms of whether they're going to grow, physically grow tall, if they're going to go through puberty correctly, if they're going to have the ability to reproduce in the future. And circumcision is mostly cultural, meaning it's not performed for any very convincing medical reason. There is a small benefit in preventing infections in younger boys, urinary tract infections. And the theory is that it's easier to clean the penis if it is circumcised. And if it's uncircumcised, you have the foreskin that's covering the head of the penis, which might allow for bacteria and other things to kind of grow and potentially cause infection. Knowing what the expectation is beforehand is so crucial, because if your expectation is one thing and then, undoubtedly many times it's not going to live up to this expectation that a lot of people have of what sex is that going to make that person not like sex? Is that going to make that person scared to have sex? Is that going to be is that going to make that person feel bad about themselves because they didn't meet this one expectation? A focal point of higher concentration of nerve endings in a girl, a woman, and it's on the anterior wall of the inside of the vagina. And it's not necessarily like you don't have to get that one spot. You don't have to get that one spot. For some women, that's a good spot, and that's something that does provide them a lot of pleasure. But for other women, it might not be the thing that does it for them, and there might be something completely different.
Hi, my name is Tanner. Hi, my name is Tanner. Okay, can you edit that, Tanner?
No.
Yeah, why?
I'm unable to edit that out. I can't. I don't know how to cut film. So we have to add that in. I'm not joking.